Leaving off yesterday, somewhere around Bursae, wasn't it? Oh, there's our answers. Everybody right? Patella, tibia, fibula, femur? Good. All right. Y'all actually studied a little bit? Didn't take much? Good. That looks like another great deal right there. Not only did you know what they are, but knowing where they are would be helpful. We talked about that. We talked about laying away. CLs. I think we are. All right, Bursa. B-U-R-S-A. It's better than B-E-R. So bursa is a flattened sac or enclosed cleft composed by synovial fluid. We talked about synovial fluid when we talked about joints and articulations, right? So these bursas are everywhere, all over the place. There's a billion of them in your knee. The function is to reduce friction between anatomical structures. So if we reduce friction, we reduce the wear and tear. So now that knee that would, without a bursa, last 20 years can now last 60 years. Okay? So the engineer that put this thing together did a super job of thinking of everything. All right? So bursa are found between the muscle and bone, tendon and bone, tendon and ligament, and so forth. There are as many as 24 bursa has been identified just around the knee joint. So if you've got, what did I say, 24? You got 24 bursa just around the knee. All right? So have y'all ever seen an inflamed bursa? All right. So we had this one guy. He landed on his elbow. He hit his bursa, and it looked like a golf ball just came out of his arm, under his skin, and there it is. Just huge, big old deal of fluid. Well, there's your key sign. One, it was immediate. Two, it's localized as far as it doesn't go all the way into a great big area. It just stays in one little sac. So the bursa is inflamed. It's mad, and it starts just secreting this fluid. Okay. One, just put a compression wrap on it. You'll be done with it. Okay. Two, protect it from getting hit again. All right. If that doesn't work, you can actually aspirate or pull it out with a needle, the fluid. But you can't do that if you've iced it. And we learned this the hard way. So this guy comes in from practice. We take his pad off and we take his compression wrap off, and there it is, this big old golf ball sitting on his elbow. All right. So we put some ice on it because it was a little tender at the time. And then in comes our team doctor, and he says, "Well, we'll just aspirate it." And so we clean up the skin, make sure we don't put any infection in. And he takes his needle in and he sticks it in. He tries to pull it out, and nothing comes out because that synovial fluid turned into something that was more like Jello. Yeah, because it got cold. If it wasn't cold, it'd probably pull out. It'd probably be a little tough, but you don't want to sit there and put the ice on if you're going to do that. Supra. All right. I want to talk about this later as far as supraspinatus, which is a muscle. So, supra. And then you have infra. All right. So, where's infra? In front. That's cute. I like that. How about inferior? So, which one is it? Which direction is superior and which one is inferior? Yes, it's above it. So, suprapatellar, the infrapatellar, They're going to be above the prepatellar is right in front. You have a pretibial, which is right on top of the tibia, the gastrocnemius bursa, and perhaps more commonly these are the most commonly hurt or injured in the knee joint. There are several fat pads. Oh yes, you cannot diet to get rid of fat pads. Doesn't happen. Those fat pads are there, and they're there for cushioning. Okay? Fat pads around the knee. The infrapatellar fat pad is the largest. Okay? So here's your patella, so it's right down there below that. So, just one summer, I was cruising around and making money over the summer, and I said, hey, let's go work the Little League baseball camp. So we did. Went and worked the Little League baseball camp. And in the process, I irritated this fat pad in my knee, in my right knee. So as I would try to throw, I'd get a little rotation on it, and that fat pad would get mad, and it would hurt really bad. And boom, I fell off the back of the pitcher's mound because it hurt so bad that I just let everything go. These fat pads are a cushion in the front of the knee, and it separates the patellar tendon from the joint capsule. So the patellar tendon's on the outside, okay? And then you get this fat pad. You also still have a bursa. So all of this goes in front or behind it to help keep everything, your patellar tendon, from getting involved with your joint capsule. All right. Now that we know what this stuff is made out of, a brief little summary. We hadn't talked about nerves, we hadn't talked about blood supply, and we're not going to. But now we need to figure out. Because one of these knuckleheads is going to walk in today and they're going to say, my knee hurts. Right? So when they come in and say, my knee hurts, the very first thing that we need to do is we got to find our history. Where has your knee been? Has it been in Africa, traveled to Africa in the last 6 months? Oh no, that's Ebola. Has it been to Central America? Oh no, that's that little virus that's going around and giving birth defects. So that's not the history we're looking for. We want to know, have you heard it before? And if you did, what did you have done? Did you see a doctor? What did the doctor tell you? Did you have surgery? What did they do as far as surgery? A lot of times these answers are, I don't know. I can't remember. Well, we can get an idea, all right, by one, looking at it as we're asking, because if they've had surgery, you're going to see the little portal holes that have scarred up from an arthroscopic surgery. If they had ACL surgery, you're going to see the little scar for if they did a patellar tendon graft. Or if they had another one, they're going to see a scar up there if they did a hamstring graft. So we can get our ideas by asking questions, but also by looking and palpating. We know what palpate is, right? Palpate. To palpate is to yawn. No, it's not. To palpate. All right? So she comes in and she says, my hand hurts. And I look at her hand and say, where's your hand hurt? She goes, hurts right here. I say, all right, what did you punch? All right? And she goes, how'd you know? Because that's going to be the deal. So when I'm palpate is to actually physically find the tissue that you're trying to find the history about and touch it. Okay? So as we touch it, doing our test, etc., is to palpate. So what'd you feel? What did you hear? All right? Did you hear a pop? Did anything? My question is, did anything go snap, crackle, pop? Because then they'll say, oh, yeah, I remember that. Was there a snap? Did you get hit by another player, or did you do this all on your own? I got hit. Okay, was your foot planted? Now that's a big key, because if you feel something to let go, and your foot's not planted, most of the time it's not going to be near as bad as if your foot is planted with weight on it. Okay? Did this happen without being hit? All right, exactly. Where does your knee hurt? And be specific. All right, so she comes in, she's complaining that her knee got hurt, she got hit, blah, blah, blah. And so, put your leg straight. She goes, my knee hurts. And she goes, and I go, where's your knee hurt? And she goes, here. Well, to her, that's pretty specific because I've eliminated all this from down here and all of this from being hurt, right? So now she thinks, well, you only got like 3% of my body to work with. But we just learned there's a lot of muscles, there's a lot of bones, there's bursa, there's how many ligaments galore. So we don't have this narrowed down at all in our size, in our eyesight. It's only narrowed down for the athlete. So we got to get super specific. So you need to find out ways to do this. So one of the things that I would do is I could pull out a dime or whatnot. This will represent the dime. And I'll tell them that this is magic. Take the magic dime. Take the now don't wave it in the air because it's real thin and you'll knock the magic out of it. But put that dime exactly where it hurts the most. And so they take it and they'll put where it hurts the most. Now the reason it's magic is that we've gone now from here to one spot. See where the magic comes in? They don't have to understand that. Also, my silly little story sort of takes their mind off of all that's wrong in the world with this knee, okay, just for a second, and helps you concentrate to help us out. So, if they're not going to be cooperative as far as saying it hurts right here, no, it hurts everywhere. Of course, you're going to find out that the younger they are, the more drama you're going to have. Oh, it hurts everywhere. Okay? Somebody who's actually had something like this happen before, hurt their knee or an ankle or whatnot, they're going to be more cooperative, usually. All right? Has your knee hurt like this before? And if so, when? And have you had it looked at? What was the injury? All of this history helps us out. All right? So, all right, when did you first notice the conditioning or the condition? Was it an immediate injury such as you were out there at practice and someone hit you? Or is this something that somebody that's coming over from the junior high and they're saying, well, my knee's been hurting for a month and they finally told me that I could come over here. It's been hurting for a month? Where's this been hurting? What exercises do you do that makes this hurt? Does it hurt when you start to run or stop running? There's so many questions that you can go through. And as you get older, you'll understand some of those questions. We'll start narrowing it down, and then bam, you get an idea. So is there swelling? And just because there's not swelling right now doesn't mean that this person doesn't get swelling at the end of the day when it's bedtime. Is there swelling? Oh, no. Does it swell? And this is the thing, is that you have to be persistent and just pick, because a lot of times these athletes are just absolute, okay, I can't read into the question, so go ahead and ask everyone. Is it swollen? No, but it does swell at night. Okay, that'd be great. But as opposed to, is it swollen? No. Does it swell at night? Oh, yeah, but you didn't ask me that. So you have to keep going with the question. All right, what activity hurts the most? Running. Okay, so what part of running does it hurt? Is it the actual running or is it the stopping? You know, come to think of it, I think it's the stopping. Oh, well then, tell us that. All right, does it ever catch, pop, or lock? Now we're looking for meniscus. All right, do you feel as if your knee is going to give way or has it already done so? And does it hurt to go up and down stairs? Oh, key sign of patellar tendonitis, hurting going up and down stairs. Right? Lovely sound. All right. Does the athlete have a limp, or do you find it easy for them to walk? You're so bored, huh? Can the athlete be full weight bearing, partial weight bearing, or non-weight bearing? These are signs. Is the athlete able to perform a half squat to extension? Can the athlete do up and down, can go up and down stairs, or do just step ups like so? Can they do that without hurting? All right. So once we get our history, and the history will help lead you to what problem there is. Okay? So, through testing of the knee, you can get a better idea of the stability of the joint. How stable is it? And then it can help us make an informed decision about what their playing status is. All right. So I've given you the story before about the guy that he was in on a kickoff, not a kickoff, extra point. The guy came around the edge. This guy goes to block here, has his leg exposed, and the other dude runs him right over. Okay? He has torn his medial collateral, and he has also torn his anterior cruciate. So I go out there, and you'll feel this today. I went and did what's called a Valgus test. I said, oh man, that's terrible. Because it doesn't stop, like you'll feel it. It just keeps coming. And you're like going, if I keep pulling his leg will be at his hip. So of course you finally stop. Then I did a Lockman's test, and it was loose. And so we sent him to the hospital. He can't play. Next thing he's going to do is tear his posterior cruciate. He's going to completely dislocate his knee, tear his artery, popliteal artery, and he's going to lose his leg. He'll end up with surgery already, but he'll end up with even more surgery and have a tough time forever, worse than what he's ever going to get. So we send him to the hospital so he can get, one, painkillers, all right, and two, we can get some x-rays, make sure he hadn't got chipped anything off. He comes back in the second half with a note from his doctor that says he can play. I said, are you kidding me? Did he see an orthopedist? Because I called the ER. I said, did he see an orthopedist? And the nurse was going, laughing a little bit and going, yeah, well, he doesn't have a fracture. I said, no, he doesn't, but he's got a complete tear of his MCL. He's got a complete tear of his ACL. Do you think that warrants him having a note saying he could play in the second half? Come on, people. So knowing how to do your test will help determine whether or not they got an MCL, they got an ACL, they got both, they've got meniscus. If you got ACL and MCL, you're not going to do a meniscus test. But if those two are fine, you can then do a meniscus test. All right, because you got to have those to help you with the meniscus. Knowing this test, how to perform it, that takes practice, time to understand the degree of the damage done to the knee. So, valgus and varus. And that's what you're going to have to understand is which one is valgus and which one is varus. Okay? Yes, you have to know the test. You're going to have a picture on your deal and on your test. The picture is going to show you somebody doing a valgus or a varus test. And you're going to have to tell me which one it is. All right? These are intended to reveal laxity. What is laxity? No, it's not like a laxative. Yeah, well, let me think how I can say. No, it's not like a laxative. Laxity is looseness. It's not tight anymore. I guess it could be like a laxative. Huh? But the knee is not tight anymore. There is at the joint. And so since it's not tight, it makes it to where you're susceptible to even greater injury. All right? All right. We could probably do it with palms if he wipes his legs down. It's pretty sweaty. Are you done now? All right. Let's come over here and lay down. Let's give him a towel. We can dry these legs off and we can go through it. Yeah? No. We'll show you. All right. So, the valgus and varus are to test the medial side and the lateral, the medial collateral and the lateral collateral. All right? So you're going to put it in 0 degrees, and then you're going to put it in 0 degrees. Because remember, what we learned about the ACL and the posterior cruciate, they help with rotation, and they also help with medial stress. So we're going to have him go ahead and lay down. All right. You had any problem with your knees before? Never had any problem with his knees.
I've had liquid gets in there.
Liquid gold. All right. The biggest thing that you've got to make sure that they do, they have to relax. Okay? Slide over here a little bit. If they don't relax, the muscle is actually going to compensate for the ligament. We don't want that because we got to find out how much of the ligament is actually torn. Okay? So, is that you? So, what's a ligament do? A ligament holds what to what? Holds bone to bone. Very good. So, this is tape, but we're going to call it a ligament. Okay? So, all day long, that ligament is going to hold bone to bone. So, this tape has about 30 pounds of tensile strength, meaning that 30 pounds all day long, it'll do this without tearing. If I put 40 pounds on it and tear it, it's going to tear it, right? It'll rupture through. So that's just like a ligament, up to a point. Now, this is one bone. Here's the other bone. Obviously, it's not the scale for people, maybe for an elephant. All right? So there it is, all day long. Now, what is a sprain? Sprain is tearing of what? A ligament, yes. So I get a tear in my ligament. That right there is probably a 1 plus. They go by ones. 1, or they go by plus, 1, 1 plus, 2, 2 plus, 3. Okay? That's your grading. Here it is. Remember how hard I was pulling? Boom, it's torn. So we got to know whether or not he's got a tear in there. Just like a ligament, if you're just like this tape, if the tear is already there, to continue tearing it, it's going to be really easy, like a towel, a shirt, or whatever. So we want to find out how his ligament is. All right, I need you to relax, relax, relax your hip all the way down. All right, and once he does that, we're able to relax. No, I don't need you helping me. There you go. There it is. I'm pulling, and he's tight as a drum. I mean, drum. Okay, so I put one hand here. That's going to be a fulcrum. All right, and then the other hand, once I get him relaxed, I get him about 30 degrees, and I push the left hand in. Doesn't have to be your left hand because it'll be different on the other side. I push the top hand in, and I pull his ankle out. All right, he doesn't have any pain. No pain, no mild ligament injury. All right. So the very first piece would be this ankle or this knee would have about the same tightness as it would healthy, but it hurts. He's got a very mild sprain. He's probably going to be out for the next week. Okay? The following week is questionable, but certainly out until you're completely pain-free. Now, this one here, watch. This one is Valgus or Varus. All right? I'm going to give you a clue. If I put my top hand on the lateral side, I'm not calling you loser. All right? It's on the top hand on the lateral side. See the L? That's the valgus. VAL. Now, when I want to test his lateral collateral, which is not near as common an injury as your medial collateral, I come down and I'm going to do the same thing, but I put my top hand on the medial side. Got it? Questions? Hello? So which one is this guy doing? Valgus. Exactly. Which one? Let's see. Valgus varus explains what that is. All right. Valgus varus. This one. Okay. So which one is this one? Yes. What ligament is he testing on that right there? We just talked to you. We just showed you. What ligament is he testing on that one? We can do Jeopardy. Do, 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 His lateral, he's testing his lateral collateral. See, he's not touching the lateral collateral. He's pulling against the lateral collateral, right? So this one is testing what? That one's testing the MCL. Exactly. So your hand is on the opposite side of what ligament they're testing because that's your fulcrum. All right? So, which one's this one again? And what's the name of this test? No. No. Varus. Very good. All right. So, there you go. He's got. I don't see any laxity with this. Or I see that there's very well. This kid here has got some laxity right there. See how far that tibia comes over? Now, we're not sure because we haven't done what? Tested the opposite knee. Some people are just loosey-goosey, okay? And so if you find somebody who's a little loosey-goosey, you need to come over here and test his other leg. Okay. Lift the leg and flex it. And do the same thing on the other side. The other leg. See how that works? Not a real difficult test. All right. Now let's talk about your anterior cruciate and the ligaments, how to test it. Remember last time we talked about, what's that one where we take the ankle and we go like this? No, that's where we go like this. Exactly. The drawer. Well, there's also a drawer test for your on. There's also an anterior drawer test and a posterior drawer test for your ACL and your PCL. So you put it at 90 degrees. The athlete, let's see, drawer test at 90 degrees. The athlete lies on the table with the injured leg flexed. The examiner stands facing the anterior aspect of the athlete's leg, both hands encircling the bottom of the portion of the leg, the upper portion of the leg, immediately below the knee joint. Fingers examiner, blah, blah, blah. We can read all this that you want, but here it is. Okay? So, what you do is you have them put it like so. Get a little internal rotation. Okay? Do a little internal rotation. See if we've got this. There's your hand. You can take your hands then, and you're going to pull out towards you. Okay? So here's your drawer test. Usually take my hip, I sit on there. Now, bring them down a little bit. Here's your hamstring. You know those little strings right there? That's where your hammies are. You can take your thumbs, put it up here, and that way you can get a feeling. Now, if you do this on him, you're going to feel where that ligament is taut. It is just absolutely going to just stop it. Relax your leg. Don't worry about it. I'll hold it up. Better. See how it comes out a little bit? It's only coming out, what, quarter of an inch? His ACL is intact and in doing its job. All right? Now, I can do it the other same way, and I can go here and then push back, and you can really feel that thing pop to a stop. So it's posterior cruciate also doing its job. Here's the tricky part of it. You've got to make sure that when you're doing this, that you're finding either the ACL or the PCL that's torn. If the posterior cruciate is torn, this knee right here, the tibia, could actually start farther back because the ligament's not there to hold it in place. So when I pull forward, it looks like, oh my gosh, I think he tore his ACL. Might be, might not be, because it started backwards farther. So there's a couple of other tests that we're going to go. That is the anterior drawer or the drawer test. All right? Now, we've got another one that's a little tougher to do, especially if you've got small hands. It's called the Ligament test. All right? So we're not going to actually bend his leg up that way, but what we're going to do is we're going to put him in a 20 to 30 degrees flexion. We're going to hold here and here, and then we take our hands and we do a shearing back and forth. One goes up, the other comes down, back and forth. And so the Ligament test is going to check that out. Let's see. Here's your picture of it right there. All right? So with a Ligament, relax. All right? So I take it, and I feel that right there, and he can feel it. Come here and feel this. It's not bothering you, right? Come, I want you to put a laying of the hands on because you need to feel how this feels. Quickly. Running out of time. All right?
Here? Ew.
Feel it stop? Pop to a stop? Come on.
I don't know.
He's getting a little tense. Relax. See how that pops?
Yeah.
So come on. Don't turn your nose up. It's just palms. You both can do it at the same time. All right, relax. Feel that pop? That is his ACL doing his job. Now, if I go to the next one and I don't get that, then we got a problem. Now, here's the thing about it, is that with girls, y'all are weird. Okay? Sometimes we don't get that pop on either side. So with girls, it could be a mush. Instead of a pop, it could, and without it coming way out, it could just be mushy, and they could have torn their ACL. So if you get one of those, send them to the physician. Posterior cruciate ligament test. You've got the posterior drawer, which is the same that we just showed you. We showed you the anterior drawer we pull out. Posterior drawer you push in. Just like that. That picture there. All right. Now here's the Godfrey's test, or the posterior sag. And I'm going to show you one. I don't think it's on there. But you're going to take your legs and you flex them at the hips 90 degrees. And you flex them. See the picture? Let's do that. Up we go. Yep. Both of them come up. Look. Lexi. This is where it is. All right. What we'll do is then we'll look to see whether one of these sags lower than the other. That is Godfrey or Godfrey test. Got it? Gravity will help pull it down. And that is, again, posterior sag or Godfrey's test. All right. So you're going to see a picture of that, and you've got to know those names. All right, here's one other thing that's not on your deal that I found to actually be a really decent indicator of whether they have a posterior cruciate ligament tear. I saw this at working in a clinic, and the guy came in, he had a posterior cruciate ligament tear, and he takes his shoes off just like guys do. How do guys take their shoes off? They stick it right there, and they pull their heel out, right? And his knee would do this. Whoop. The bottom part would suck back in. He would do it on the other side, and it would just barely suck back in. But the one that didn't have this cruciate. So what I'll do is I'll have him bend them, and I'll tell you, take your heel, pull it to your butt, go. And as he does that, if he's got a posterior cruciate tear, this will slide back. Okay? All right. I don't know. Let's see here. We could probably get this last one in. We got time. We still got 7 minutes, right? So, a meniscal tear. This is called McMurray's test. Okay? A McMurray's test is used to help determine displacement or tearing of the cartilage. Now, remember when we talked about those 3 injuries yesterday? You have a little bitty tear, you can have a bigger tear, and they can have, what's the biggest? What? The bucket handle? Exactly right. The bucket handle tear. All right? So what we're going to try and do is we're going to try and manipulate the leg and get it to where the condyles of the femur and the head of the tibia trap it. And when it traps it, it will make it click. You're not going to hear the click, but you'll feel the click when you're doing it. So with our understanding and awesome model right here, we take this leg and we come up. No, don't fight me on this. Get him to relax. All right, we're going to come in, and I'm taking my hand and I'm putting it across the joint line. I'm taking it and coming in here, coming all the way down. And if he's got a meniscus tear, right about there, it will start, and then bam, you'll feel a clunk. And then we can take it the other side and check the other side of his meniscus. That is McMurray. Once you have done a McMurray's and you feel it, you'll know from then on out what it's going to feel like, because it's just a thud. It's like boom. Now, some of them click or thud harder than others. Obviously, that's probably going to be a bigger tear. The other ones, you can get through it, and you'll do it about 5 or 6 times. You might get 4 out of 5 or 4 out of 6 of those getting you've got a little bitty tear. It's usually back in the posterior horn of the meniscus. But those big bucket handles, a lot of times you don't even need to worry about them. They're going to be flipped over, and they can't even get their leg extended. McMurray's test. You'll see this group of pictures. You need to know what that is and what it's testing. That is your McMurray's test. Let's talk about prevention tomorrow. Do we need a quiz? Sure, you all are comfortable with your grades because it does nothing but make your grades better.